So let's roll. Let's do this. So welcome everybody who's tuned in and logged in online and in person. This is Meridian Psychotherapy Services, real people, real talk. This is episode 2, and we didn't plan on having an episode 2, and then some things kind of came about. My name is Salo Ortiz. If I haven't met you online because all I see is a black screen, that's okay. I'm one of the therapists here. And I have a few guests with me, 3 in person, 1 online that I'm going to give a hard time to the entire night. And I think that that's okay because it's after 6. And so we don't have to be professional. We can be real. So Kurt, you're just going to get
keeps on our toes.
What I ask everybody online is to stay muted. You can definitely turn your camera on. That's fine. But just stay muted for at least the first hour or so, just because we want to have just an ongoing sort of dialogue here. There is nothing scripted. I have some notes here from a conversation I had with an officer just yesterday. That's it. There are no scripted sort of thoughts here. Some people are scared to death of that because they don't know where it's going to go. And honestly, I don't either, but that just gets me more excited. But I wanted to provide a platform for, not a space where we say, look, we need more clients at Meridian. Not a space where Kurt says, hey, we need you to send your people here. Like that wasn't the point. The point was to be able to just have a real honest conversation about mental health treatment, interventions, some of the frustrations and some of the maybe possible solutions that we see, just on the ground level. So that's it. And so I pray that you guys hear us okay. If you can't, feel free to type that in, but I've told everybody here to talk loud and we're trying a microphone here. I think that we're going to be okay. So let's roll. Let's do this. I will not waste your time. We will take open questions towards the end about the last 30 minutes. And so I'm just going to kind of look back and forth. For those who are very, very COVID worried, we screened everybody. Everybody's safe, except for the guy in the end. He worries me, but not because of COVID. He worries me for other reasons. No, he's actually cool. We are all healthy here and safe here and trying to make sure that we enjoy staying that way through these crazy times. So thank you guys for coming out in person. And thank you, Kurt, for being here on screen and taking your time. So that's it for me. I'm going to start over I'm going to do ladies first. We're going to be gentlemen. And we're going to go ladies first and then get these guys in person and the guy on the screen will introduce himself. Let us know who you are, why you're here, which is the short answer is I forced you, but who you are, why you're here, and just that's it. A little bit about yourself and that's it. Nothing crazy.
Okay. Jennifer Zabel. I am here because I love my son and I want to be a voice as a parent for adult children who might be going through mental health crises or living with a mental health illness. And a little bit about myself. I'm just here as a mom, so that's okay. Fine.
Perfect. I'll take that. Thank you, Jennifer. Let's go to the fine young man over here.
My name is Alex Zabel. I'm married to this beautiful lady to my right, and so I'm here also as a parent of a boy I love very, very much. Yeah. And thankful to you, Salo, for creating the space for this conversation because mental health is such a necessary and needed conversation today. There's so much that goes on, I think, today and in this world, and if you haven't been introduced to it in some form, then you can be quite unaware of really what's going on. Yeah. And for us, it was March of 2019 that our whole world changed. When I got a phone call that something was going on with with our boy, and then trying to navigate how to help him and how to work through the mental health system with an adult child. We can't just make decisions for them. There's a lot of other moving parts that come along with that. So I'm sure we'll get into some benefits and some great people that we've met along the way that have helped us. And then there's also been some challenges that we've gone through for sure that have been very, very difficult. But I appreciate you opening up the dialogue.
Definitely. Thank you. And that's exactly what we want, Alex. We want just open dialogue. Oftentimes dialogue like this comes as a result of pain and suffering and hard times. I wish it would have come about because it was a healthy, reason to and just introduce it because people were ready. But often it comes because there was something and that's why I brought it up. So thank you for being a part of this journey and my story too. So thank you. Cool. Who are you?
I am Adam Hoxter. I am I guess 17 year or so officer in a local agency with law enforcement. I guess I have spent the whole of my career being frustrated with, I guess, sort of the system, and it's much bigger than us. But I've been having the opportunity to be involved in many situations like the ones they've indicated, but I'm there quickly. I provide stability for a moment, and then I leave because there's other calls.
Right.
And that's been the history of my work with the people who are struggling.
Yeah.
It's unfortunate, but it's the way things
But it's the
are.
reality.
Yeah.
Yeah. Man, thank you, Adam. Yeah, that's true. Thank you. I'm glad you're here, man. Kurt, tell them who you are.
First of all, Solid, thank you again for just in Meridian, just for taking the initiative and the intentionality and the motivation behind this. It's such a like a pregnant moment in time, so to speak, for behavioral health to be in the spotlight, and to the point of the other guests. And I just want to acknowledge also, the difficulty that you've been through, and I can imagine the roller coaster. But with the crises that we're in now, it's an opportunity. It's unfortunate that it has to come to often a point of a crisis, for things to come into a higher resolution awareness, and we still have work to do in that regard. But just to back up a little bit, so I'm the CEO at Virginia Beach Psychiatric Center. Did not expect kind of an accidental CEO in some ways. I'm a licensed professional counselor by training, and went through a bunch more school and more on the clinical side, and 21-year history, both as a provider, a clinician, and an administration for behavioral health here in Hampton Roads. So very near and dear to me. I'm not at all ashamed to say, and nor should any of us. I've been on and off, be a mental health consumer in counseling, and always will be the rest of my life. It's healthy and sometimes needed, and it's one of the reasons I wanted to be on here today. Is just not in terms of my role, but just as speaking from a consumer point of view, and consumer advocacy, care recipient advocacy is really kind of the genesis of why I got into this field to begin with. And so, being in the role that I'm in now, and I won't, for the purpose of introduction, get into a lot of details, and we'll see what fleshes out in the discussion. But there's a real crisis with access across the continuum of behavioral health and substance use services right now. It's not just our state, but in our community, it is throughout the nation. But we feel it here, and I'm fortunate to kind of be in some political forward-facing areas, working with the Department of Behavioral Health, the Commissioner, the Healthcare and Hospital Association, trying to just our local legislators and beyond, and just really getting the stakeholders to really understand the extent of what the difficulties and challenges are for the persons that are in need of services. The hope and idea is that we're put out of business at some point, because people don't get to that point of crisis, because there is a known and coherent way for individuals to access a system of care that can get ahead of that upstream, and can work together and be resourced properly to prevent that from being necessary for someone to need to be admitted to a facility for safety reasons. And now understanding that there's always going to be some need for that, no matter what. the life circumstances can be a reality, despite, you know, all of the pieces being fitting together as they should. But truly, we have so much opportunity to have a more approachable, comprehensive, coherent, and well-resourced system of care. And that's really what kind of gets me up in the morning and keeps me moving forward. And yeah, I've worked in crisis mental health forever. So I've worked in emergency departments, in the middle of these scenarios with police officers, with family members, with their children, with their parents, themselves, in the midst of really just intense, probably thousands of situations. And myself, even someone, who became a subject matter expert in how to navigate through that system, even in that situation, sometimes not really being sure how to help best. And so it's incredibly challenging. I feel great compassion and empathy for the folks that are out there that just can't get the help they need or don't know where to begin. And also, get the wraparound services and support and just feel that pressure of stigma and shame and all those things that shouldn't be associated with mental health is healthcare, period. And that's how we need to be thinking about this. And I'm encouraged the conversation is coming out stronger in the media, and every chance I get and I'm asked to speak in the media, I do. I look forward to the discussion, and I'm excited. Let's see what happens. So sorry for the long intro, but thank you.
Nah, man, listen, I wanted to organize this, as four real people just having a real conversation, and that's okay. What I pick up from you, Kurt, and from all you guys, right? This is personal, heartfelt, for one reason or another, either our own personal journey from family members, our interaction with families, or even our own personal journeys. And Kurt, you hit the nail right on the head. It's funny, in our industry, the stigma that exists society-wise, community-wise, not just for mental illness, right? I have one. COVID has allowed a lot of people to be okay with it now, like depression, anxiety, but thank you, COVID, I guess. But God forbid, in this industry, we say that we get services. And so my clients always laugh at me because I tell them, yo, I got 2 therapists. They're like, yo, how crazy are you? I'm like, you have no idea. Like, we've got to be okay to acknowledge that we need help. We've got to be okay to acknowledge that this is a normal thing, like the cold, like the chickenpox, right? Like, we have to address this. But we constantly live under this thumb of the stigma. And so this is personal. And then there's the parts of the journey that you alluded to, Kurt, and you guys did too, when we just kind of look at the frustrations and the roadblocks, but then some of the help. This was not going to happen. This came about, I'll tell everybody, in about 3 weeks, I think. I had a personal journey with a family member having to get TDO'd and go to the hospital. And my family just went, it just got flipped upside down, not because mental illness was a surprise. We've been living with it. But when there was a need for emergency intervention, a few things kind of unfolded. And I'll spare all the details just to say, there's a process in place to get help to be preventative, and you have to be suicidal or homicidal to be preventative. And we hated that because we're not going to lie. And so there's integrity in the work that we do. And then to have, the officers that have their hands tied, and it's not their fault, but they were trained a certain way, have limits because they have their limits. And we say we can't do anything more. And then we go through, and our family member gets hospitalized, and we're left literally in the dark. So it's 2 a.m. and I'm standing outside the house saying, well, what now? And I've been doing mental health work for 20-something years, and I didn't know what to do. So then kind of fast forwarding, try to figure out where to get them a bed, where to get them help. And they say, yeah, settle in. We're going to be here for like 3 days. Oh, hell no. I'm not doing this for 3 days. I haven't slept. Nobody slept. Everybody's worried. We got no answers. And so, yeah, I called people I knew. And so I hit Kurt up and I said, Kurt, we got to do something. And that's sad because I'm 20-some years into this. I have a strong name in the community, and I got to call a friend and for a favor, phone a friend sort of thing. And Kurt, help me out and get him a bed. The process took us 12 hours. And that's fast. Everybody said, everybody was like, I don't know who you know. I don't know what you know, but you made this happen in 12 hours. And I was like, and that's fast? There's something really wrong with the system if 12 hours is fast. You know, how many turkeys can you cook on Thanksgiving in 12 hours? Like, this is crazy to me. So 3-4 days, we go in and we find out that the TDO is extended and we didn't even have any hand in it. We don't know what's there, what's written, where they're going, who's going where. This is not a finger pointing sort of thing, but there's something wrong with the system if we can't have an honest conversation from, and this was intentional, parents that have walked through this, law enforcement that have had to be the bearers of this information and take it back, right? And somebody who runs a facility that provides acute care and says, look, I can't do it, my hands are tied because I don't have either the funding, the staff, the space, and the many limits that go with it. That's a real concern. My hope with this conversation, we're recording it, we'll put it on YouTube, it'll live forever. We know that. But that it gets in the hands of the necessary people. From that, my experience, I invited city council, I invited magistrates, I invited law enforcement of many levels, right? You guys can see on the screen, we don't have 700 people on this call. And I called everybody I knew because I was pissed. I was flat out pissed. I mean, I'm still pissed. This was weeks ago and I'm still pissed. I can't imagine years and years of this. I can't imagine seeing it over and over. You know, I can't imagine having to turn people away and tell them, nah, my hands are tied because of insurance, because of the rules of the laws, the politics. I was pissed. Let's get this in the right hands. Where will it go? I don't know. But it's our responsibility here to have the conversation. I think it's everybody's responsibility who listens to this today or moving forward to get it in the hands of somebody to say, look, this is happening and we need to do something about it. And so that's how movements start. And so I want to really encourage people to really do something with this, to really check their hearts and say, where do we go with this? So that's me. That's why we're here. Question is, let me go into this. So we talked about the intro, we talked about why we're here from a personal journey. So looking at it from law enforcement, right? As you look at this mental health system that you've been involved in from a law enforcement perspective, personal perspective, what do you see as the pros and cons for how you do the work when it comes to our mental health, you know, civilians and citizens?
I mean, that is a can of worms.
Yeah, it is. Let's open it. I like worms. Let's go.
There are so many.
Give me a couple. Just give me a couple that you think we can tackle.
I think the biggest just issue, the most basic, is the fact that law enforcement is there for law enforcement. They're peace and well-being, but it's our job is make the situation safe, and if somebody needs to, take them to jail.
Right.
Our job is not by state code even to be involved in their mental health. Unfortunately.
Wait, even if you get, so you got, you know, crisis intervention teams, specially trained teams for law enforcement that are trained in mental health and substance abuse. And yet you're saying our job is not to deal with and do the mental health therapy or the work, even though you're trained in it. Because some of us as civilians, right, we say, look, you're trained in this, yo, help me out, or give me a little bit more grace. How does that work?
I mean, that's a complicated thing because we are trained. We have, and some of us, I mean, we're all people. So, you know, we're all different. Lots of different people wear the badge. Lots of different people use it differently. It's sort of a question for each individual.
You can't answer for everybody.
Yes.
Like, and I get that from even a race perspective. People say, you know, I'm the spokesman for all Black men. No, I'm not. I can speak for what my experience is, and I think everybody will respect that, for sure.
Gotcha.
For sure. But what's your take on, like, how does that work?
My hardest issue, I guess, is just not being able to. I mean, I can go to a 12-year-old little girl that is diagnosed bipolar, that won't take her meds, and the parents don't know what to do.
Right.
And then I get there, and all it does is I ask the girl, why won't she take her meds? She says, because they hurt my stomach. I'm like, well, that sounds reasonable. Why do you need to take these meds? And then her parents say, well, she was, well, actually, she tells me first that she was sexually assaulted recently.
Wow.
Which makes me go to the parents, say, did you know about this? They say, well, yeah, but we did, so we figured she'd be okay. And they weren't. Right. So it took some education, which me as a police officer didn't really have the time. didn't really have the okay from everybody to do it. However, I took them up to a facility where she could be a part of a more college dorm type of situation where there were counselors, there were people that were in the same situation, counselors that could help. And the mom, it was a new experience for her. It was training. It was, here's something you can do to help your children.
Yeah. So here's the thing, Adam, right? There's the personal element that you bring to the job and to the work, especially appreciating mental health, substance abuse, whatever the situation is, trauma. It's an individualized sort of thing with each officer in whatever jurisdiction. This is not just your city or Virginia Beach or anything, right?
Yeah.
But every one of us, so this is where I'm gonna turn to you. I'm not saying you guys have said this, but many families will say, well, yo, give me the same pass. Because every family is going through their crisis at that moment and they need their help. But if you did that with every single person, I mean, you'd be out of a job, you'd be written up, you wouldn't even be available because of all the backlog and the paperwork and God knows what else. But that's hard because we're real people. So what do? Right? So I'm gonna transition from that. I'm like, what do you do? What are the pros and cons? Because we need that little bit of extra grace and we need some help in navigating this. And we don't know where to turn, but you know, Adam comes and knocks on the door and he helps you. He helps a little bit, or maybe he doesn't. And then we get worked up. Like, so what do?
I'd like to begin by saying, one, how much I really appreciate law enforcement, because one of the heroes in our journey was law enforcement. We were sleeping, it's 4:30 in the morning, and my son called me on someone else's phone, and he was at a particular restaurant, was very confused, didn't have money he had ordered breakfast, didn't have money to pay for it. And there was an officer there who had other options, clearly, but what he chose to do was pay for our son's breakfast. And he waited for me to get there. And then when I showed up, he wrote down his number for me, anything else I can do, because, you know, at the time we weren't presenting harmful to ourselves or others. He sent us home, and sure enough, we did need him. And within minutes, he showed up at our home and tried to help us get to a position to help our son at a local hospital. Then things turned there, and we were in a similar situation that you described, except we didn't have a phone a friend.
Right. And that's sad because I had the connections, you didn't.
Yeah. So we were literally we got him to the hospital. There were no beds available at the moment, but that was fine. We were at a hospital and going through the process, and then all of a sudden a nurse intervened and just said, you know, you don't need to do this if you don't want to, right? And, you know, of course, he was in a confused state, and he didn't like the process. And so that was it. And we were sent home, and then that was the end of it. So it was very, very challenging for us, but I so appreciate that officer, and I can't think of his name, but man, what a hero in our story that day.
And for the record, I'll tell you real quick, because in my own journey with my family, you know, I did take the time to highlight those officers and say, look, this is worth you telling, because and what I told one of the conversations yesterday with the sergeant was, you hear when everything's bad, just like we as therapists hear when everything's bad. We don't hear when we actually help, you know, and so we want to point that out. So thank you, Alex. That's huge. And that's scary because that was maybe the first or one of many experiences, right? So Jennifer, like what are the highlights from that, or what are the lowlights? What are still the hard parts, or what are the things that thankfully, right? We said thankful for the officer, but what else?
So I'll start with a positive. There was another gentleman, and I can't remember if it was, I think it was somebody from VB Psych, like there was a helpline or something. And I mean, he was just so compassionate. I was probably like, you know, in a panic state. I don't even know, probably saying too much, not saying enough, you know, kind of thing. And he was able to talk to me in a way that was just like acknowledged the emotions I was feeling, but also was authentic. I could tell he really wanted to help. And he's actually gave us a referral that led us to a great therapist. Yep. And really, you know, and the reason he knew to refer was because he heard what I was saying about what would connect, what would be a connection for my son. We talked about the therapist he was currently with, great person, but they weren't really connecting. And I said, he really needs somebody like this. And he listened and he connected me, you know, and gave us that opportunity.
Two things that I'm hearing real quick, Jennifer, right? Compassion was necessary. Listening, you got to listen. And so sometimes it's really easy to get caught up in all the extra and the animation. There's a need for safety, no doubt. but sometimes we get so distracted either by what the language or the activity to not really listen and have compassion for what's really going on, because distress is distress. And all of a sudden, some of us feel like we got to fix it or we got to do this without really listening or hearing it all the way out. So, yeah.
And then the other thing I would just say, there's really a couple of things, but one of the things is, and Kurt said this, you know, having that space in between the crisis and getting to the hospital twice now, it's been challenging to, why do we need to get to the point where we're hospitalized? You know, the first situation was, you know, we call saying, you know, can we talk with the doctor? We'd like to get, you know, some medication so we can avoid hospitalization. And the comment is, you know, first we don't get a call back. Then the next day it's, oh, if you're in crisis, go to the hospital. Well, we don't want to get to crisis. We want to have something happen to help prevent crisis. And I think the canned answer, if I'm being honest, is go to the hospital, hospital. But why can't there be a mid and in between?
Right.
And so
Really good point.
In that particular instance she's referring to, the provider dropped us
because we want to go to the
in
hospital.
that moment. Totally dropped us. So now we had no provider, no ability to get medication.
And no knowledge of the system even to know kind of next steps.
No, so that was rough.
And can I just add, we did what they said. We went to the hospital.
Right.
There was no bed.
Right.
There was no reason for a TDO. Right.
Temporary detention order for those who don't know what that is.
We couldn't get that. And so then we go back and say, we tried, sorry, we told you to go to the but we did, bye. And we just got dropped.
Right.
And you know,
so you're left there holding the bag again to say, well, we either wait till he escalates, videotape this, make him escalate, lie, right? Some of these sort of things, but then it may be too late, because then you still got to wait for Adam and his crew to show up, and it may take them 10 minutes or 5 minutes even, but a lot can happen in that time. And now it's an even bigger safety concern, and that's scary. So Kurt, you're in a tough spot, dude, because you run an acute facility that has beds, but there's a couple of things that are real honest here, right? Everybody, you know, that's the number one, like, Family Feud answer, like, take them to the hospital, which has to frustrate you on one hand. Yeah, that's great. It's a business sort of thing, but a lot of that could be avoided, right? And so what's your take on that, from the take them to the hospital and let them sort it out sort of thing? Because there's breakdowns in the system. The other thing is that, and I'll own that as a therapist, right? That we say, well, if you're not gonna listen to what I say, you're not compliant, go ahead. Because a lot of this is about liability. And we don't want to be left holding the bag, right? This is a risky conversation for parents, for law enforcement, for me as a clinician with a practice, right? Kurt, this is a risky conversation, but it's honest. The first intervention is take them to the hospital, let them figure it out. What do we do with that? And you know, we know that there's help there, but then there's even breakdowns within there. So what do you do with that, Kurt?
Yeah, the de facto kind of way that the system of care with behavioral health has been for far too long has been reactive versus proactive.
Exactly.
And the de facto answer is exactly what was just described by these two amazing parents that have been through what must feel like 20 years in the last 2.5. Is the ERs have become, and have been for quite a while, sort of the de facto receiving center for someone that's having a mental health issue. Whether or not that's a full-blown crisis or someone just, you know, interested in seeking help because they don't know where else to begin. And you know, for prescribers in particular, like psychiatrists, and fortunately there are more like mid-levels, like nurse practitioners and PAs that have come online in the community. But you know, there's the workforce issue. You know, to see a psychiatrist, for example, if you just call a practice cold and try to get an appointment to see someone, because oftentimes counseling is extremely helpful initially, but it may not be enough. And what we know from research is a combination of both psychotropic interventions when necessary and counseling will yield the best outcome, you know, short of having to come into an acute care setting. So, you know, folks have often, you know, will call, you know, for example, our crisis line, and specifically they're not wanting to come into the hospital. We're not encouraging to do that unless we hear something, you know, that's of safety concern. we'll provide referrals, and we even, we know who's out in the community, or we try to keep a good tab on that. And practices kind of come and go. And in the pandemic, a lot of things have moved to telehealth. Some outpatient providers and practices have simply not survived in the economy and just circumstances, and the wraparound services, whether it be through community services boards or private providers, housing, all of these things have just become more difficult from a system that was already not working on behalf of the community members in need. And so, to get back to my original point, that first call, I want to go see a provider, and we sometimes are able to assist people to get in with folks we know by history will have after hours appointments, or can squeeze folks in, or have good accessibility, but also are good providers as well that we know have good reputations. But the waiting list can be very, very long, and is longer now probably than ever. And the workforce shortage across all domains of the economy. You all have seen it if you've been out, even trying to go out to eat somewhere. If you manage to get to a place that is actually, most places are back open, but you're waiting longer because they don't have enough wait staff, or in healthcare in particular, there's been a mass exodus of workforce, and folks have just been really, really just burnt out by the pandemic. And
Kurt, I'm gonna jump in real quick, because that was part of mine and your conversation, was the fact that you're like, Salo, even when I made that phone a friend, he's like, hey man, I really want to help, but I want to make sure I do this right. This is an honest conversation. He's like, I got to make sure I got the manpower to address what you need. Because what a lot of people don't get when they take them to the hospital is that I want to make sure, I know that your ethics is such, Kurt, that you want to do the job right. And you can't just say, okay, give me your wounded, right, and we'll do all this and not provide the right care, because that's almost more problems on the back end. And what unfortunately a lot of people don't know is that we want to do it right. And if we can't do it right, we're stuck. Is that fair to say?
Absolutely. We don't want to promise something we can't deliver upon, and also being able to communicate kind of what the expectations, folks don't know what to expect, and trying to convey that in a way, especially in a case of a first instance, for example, of a young adult who's having, a first major psychotic episode of an illness that may be manifest and may be a very chronic and lifelong. Not to say it's dooming them in some way, but the reality is that it may take, there may be multiple episodes of acute outcomes. And so it's really, but coming back to the accessibility of being able to see a provider, and then also, the situational awareness and overall awareness within our communities of, okay, this is an indicator I need to get help, or that my family member does, before it gets to a point. So being able to recognize and detect that, and then, to be human nature, sometimes we don't want to acknowledge when we need help. And so that's another factor, or have the mental capacity to think rationally amidst a mental health crisis. And so there's a multitude, it's multi-pronged reasons as to why sometimes it has to escalate to a point of a crisis to access, care at a very high restrictive level, which is not always it can be in and of itself kind of a traumatic and difficult experience for many people, just to go through that process, especially if it's involuntary. And there's so many issues to address, but I think access and awareness are.
Kurt, I'm gonna jump in real quick. Sorry to cut you off, but I'm gonna jump in real quick, because I'm gonna jump on that, because I think you'll appreciate this part. So many layers. What do we do first? It's overwhelming. Some of the takeaways from that, Kurt, that I know you guys do from a staff internally, try to, and you said this, right? You know, give you the resources in the community. Yes, you can bring them to our doors. We're going to do what we can to make sure that we provide the appropriate care, but we want to be able to provide you the resources you need. Knowing that they come from different angles. You see this as law enforcement, you know this just from your perspective as parents, just with your child, but there's so many different layers and levels of safety, risk, needs, medication, not medication, age, restrictions, and we don't know. So we just kind of throw everything at the wall. But we've got to know that the other part of it is, and some of the takeaway maybe from this is, how do we get the information we need? Where do we go for the information? I know that that's something we've talked about from a substance level, Kurt. That's something that we talk about, you know, in law enforcement. Adam can't walk around with a big old binder full of resources and for every mental health call and say, hey, take this packet, read this, right? That's not fair to him. And he doesn't know which call is which or where it's going to go, but we need that too. So some of that is the need, right, Kurt? Like how to communicate, you know, really, really intentionally and effectively the stuff that's available, right?
Completely agree. I don't have a great answer for that. You know, health literacy across the board is, you know, that could be something embedded in curriculum. I know that's been successfully done in regards to some substance use issues in particular, and some, you know, some initiatives all you and I have worked on together in groups and committees. But you know, I think health literacy, but at the end of the day, we don't have like a single source kind of access point. There's, you know, anyone can jump on the internet and Google providers, but again, you don't really know until you get there and start interacting with the provider, if that's, unless, you know, you happen to have the advantage of having some kind of a network or knowing someone inside and familiar with the system of care. It's like more often than not, still unfortunately kind of a you know, kind of a trial and error process.
Right.
And but you know, the sooner we can start with interventions before things bubble up and escalate to the point of a crisis. Obviously, that's the goal, is to avoid that from happening.
So, okay, perfect. So here's where I'm going to go with some of this, right? To go back a little bit to the reactive versus proactive, because we know this, and that's been a big part of my frustration is the reactive sort of nature of the field that we work in. Here's what we know about the reactive. I'm going to tell you just my 2 cents, may not be worth that. We can't get data, we can't get sort of numbers to go off of a proactive and the what if. It's hard to work off of a what if, so we have to almost be reactive and wait for the numbers to come in, because we want to make sure we react in the right way. And so that's why some of this stuff is reactive. Knowing that, still not fair. We need it to be proactive. We want to lower some of the numbers or whatever. So then, to speaking to what Kurt is saying, and something that we could all do. And so I want you to be able to all speak from your perspective. Something that I try to empower my clients to do, something that I want you guys to give your take on, is to have the data available. So when Adam comes to the door, when you bring your son to Kurt's hospital, this is what you're looking for. This is what I'm seeing. And so this is the data you need to go off of. Because what happens is, a lot of times in this mental health system, and it's rightfully so, we freak out. What the hell is going on? Oh my God, oh my God, oh my God, oh my God. Right? We've got to figure out, this is what I'm noticed, right? So pressured speech, you know, rapid heart rate, he hasn't slept in 7 days, right? These sort of things. That's the data and the information we need in order to be intentionally and effectively reactive. Is that fair to say? So what is it that you need to hear from the law enforcement side? If you show up to the door, what is it that you want to make sure you communicate to the people showing up or to the hospital? And Kurt, from your angle, what is it that your staff needs to see in order to be effective in the intervention? So I know that I hit it all like crazy. ADHD, gotta love it. But if you can, just grab some of that. Maybe I'll hit parents first.
Well, I think for me, I think one thing is really listening to our experience and what we're living and seeing as part of really assessing what's going on. So I think some of you, and you're one of them, Salo, are very good at listening and really hearing what we're living on a day-to-day basis, so you can make a good determination on what needs to be done and direction, right? But some of our experience has been, can't get through, can't talk to anybody, can't get the help we need, which we've all hit on. And so I think something that, and I don't know if I'm saying this at the right time, but I think something that I feel a huge need for is collaboration among providers. So I feel like, you know, I can talk to you, Justin can come to you or give permission for you to talk with us or whatever. And not everybody has that. We're very fortunate because we love him and, you know, we want to be a part of that journey for him. But then you call, you know, maybe a prescriber that isn't connecting with a therapist. And so now we've got this disconnect and we've got this mental situation being looked at differently, treated differently, talked. There's no collaboration. For me,
collaboration and consistency.
Yeah. And so I think we've sort of across these last couple of years, we've had some really great experiences with that and some really terrible experiences with that.
Let me ask this, and let me say this, just to kind of, because what I want to provide is some takeaways for, you know, people listening, people for the future, and even for ourselves, right? If the missing part is, maybe this is me being devil's advocate, if the missing part is consistency and collaboration, is it responsibility? Is it part of you guys to say, here's what I want all of you to know? You know what I'm saying? So again, like he's acting this way, he's taking this, he hasn't done this, don't you dare come to me with this because I'm gonna punch you in your face, right? If we can't be collaborative and consistent, can you give us what to work on? You see what I mean? Is that fair to say?
And that's been our attempt,
Yeah.
you know, as parents, and we live it every day.
Yeah.
And so we've learned over the past 2.5 years, some of the signs, you know, some of kind of the details of what's going on, and don't always know what to expect, but there are certain things that are very familiar. And so those things we have communicated.
Yep.
And yet I still think,
even
to
still,
her point,
even still,
the providers need to have that conversation because, you know, he may say one thing over here and one thing over here, and they may mean the same thing, but in a different context. And if there's no communication, then we're coming up with a different diagnosis and a different recommendation for medication, and he's not really getting the help.
And all the time, like everybody's kind of working busy, but not doing effective work. Fair.
So it is our responsibility to communicate well. And, you know, I mean, we love our kids so much. We do the best to do that. But,
and you'll give everything you need. And let's be real again, because this has been both our experiences, to the point of I'm not going to be unethical. I'm not going to lie. Like, I'm not trying to, right? Because there's a lot of families that say, we'll say whatever we need to. There's a lot of clients that'll receive services. We'll say whatever we need to. And we'll even lie and say, tell me what you need to hear.
You know, we refuse to do that.
Right.
And I just want to add too, like, this being here tonight is not just about our experience. I mean, for me, sitting here, and we were talking about this earlier, we love our son, and I know a lot of parents love their children. Fortunately, we've been able to be on this journey and advocating, but there's so many out there that don't have those advocates that need the system to work for them, not against them. And to me, that's a missing piece. And we were talking earlier, like, it's almost like a mid-level advocate provider, you know, somebody who helps bridge that gap for those who don't have somebody.
Or the bravery to ask for or seek an advocate, right? You guys got lucky. We got connected. But if I keep trying it and failing, or I keep getting turned down, or the door slammed, then I'm gonna stop looking for an advocate, and I might advocate in a wrong way almost. And so, yeah, that's a really great point. And I don't mean to put you guys in the hot seat of, I want to ask certain questions that I know people are going to be trying to figure out on their own too. And so I appreciate you guys entertaining that. Adam, for you, like, we see, like, there's again the inconsistencies or the issue of communication sort of thing. How do we bridge that from your level, right? If you come to the door, if there's a call or whatever, right? And we know that there's, you know, you play the old game telephone and the communication can get twisted up, but you show up, here's what I need. What do you need when you come to the door?
Not a lot. You like the calls like this, where there's a parent that calls that says their child is outside of parental control. That as soon as that comes in, you know what you're going to, you know that this is a parent at their wit's end.
So is there certain wording that we need to be able to communicate when we call 911 or we call certain people, right? We don't want to lie. Again, we're not saying that, but there's certain ways to be able to grab the attention of the person receiving it and say, hey, here's what you need to hear. You know what I mean?
Yeah. I think almost in a sense, it's not necessary. I would say for the parents, try not to tell the officer what to do.
Ah, yeah. Interesting.
That's probably the biggest thing, because
Huh.
he's there to,
Huh.
he's there in a sense on behalf of the child. Because the child is the one outside of control. So his focus needs to be, how do I get this child under control?
Okay.
And it's, you don't know the parents, so you can't necessarily trust them to be involved with you.
Right.
So you'd rather them just kind of hang out and calm down.
Which is
Because
hard for a
they're-
parent to do, because this
Yes,
is their loved one and they're
it's
freaking out.
crazy. And
Yeah,
if you get to those scenes, then you do have to spend time
yeah,
calming down the parents.
yeah.
And talking with them through some stuff, but then you go speak with the child. And honestly, most times when the child is out of parental control, it takes me going in uniform,
Mhm.
sitting on the floor with them and saying,
Mhm.
what's going on?
Right,
And they
Right.
will calm down, they will talk.
right,
We can share stories.
Right.
We can talk about what's going on here. And then that leads me to then go bring them to the parents. Then we have the whole family talk. And then I say, okay,
So-
I gotta go. I gotta go to another call.
So Adam, here's where I ran into, I know these guys may have, and many other families have, right? So you show up and you're right. It's funny thing about the uniform and the badge and maybe the gun, you know, that kind of settles some things down, right?
Yeah.
Or I'm gonna call it the bright yellow taser. Let's blame it on the taser.
Yeah.
We know that there is a need for intervention. There's a need for you to address the party that is called upon. So we hear that, right? We hear that. But then we also know that it's going to escalate later after you leave, right?
Yes.
Right? There's an
Yes.
old movie Friday. We talk about when you know, when Debo show up, everybody calm down. When
Yeah.
he leave, we be talking again, right? We know that you're going to leave and things are going to escalate again. And so maybe, is it fair to say and put it on you and your crew, you're the representative,
Yeah.
to say, tell us what to do when this escalates later. You see what I mean?
Yeah,
Because sometimes
absolutely.
you guys leave and we're left with them. We're like, well, man, he's calm now and we're here and we didn't see what we needed to, so we're gonna leave. Yes, you can call us back, but that's not enough, right? So what is it fair to say to put on you on that? I know, I'm
I mean,
sorry.
it's hard because I can tell you from a law enforcement standpoint, they're not going to say, okay, we need to train our officers. We need to give them these certifications. We need to give them this training so that they can go to these calls, give them these resources, give them these coping skills, give them these, you know, all this stuff, because that's not what they're paying us to do. You know, it's a whole different thing. But on the flip side of that, more effort in that regard would help taking officers away from the street who have to go up to the hospital and sit for hours while we're
Right.
waiting on a TDO.
Right. But what do these guys got to hear? You know, you said, ma'am, I calmed your son down. He seems to be kind of all right. I know that he's going to ramp back up. Here's what you need to do, right?
Yeah.
What can you give them in that moment?
Well, that's a tough thing because a lot of the problem that you're facing there is learned behaviors in the family, learn roles.
Right.
And
Right.
so they have ways of responding and reacting to each other that need to be worked on and that need to be worked through.
Right.
So many times I'll offer family counseling, suggest any counseling agencies I
Mhm.
may know that do that.
Fair. Fair.
But that's the scope of my abilities as
Right.
law enforcement.
Right.
So,
Right.
I mean, I can give them a quick, maybe family session. You know, like
is that
where-
what you guys want at that time? Right. I don't need the counseling from the officer.
Y'all counsel.
I need to know kind of where do I go when this starts getting a little out of control again. And then that's fair maybe to say, hey, tell me what agency to call. Tell me what number I can
Maybe
call.
I should be able to give you numbers, give you
Right.
names of people that I know that can
Right.
help you, names
Yeah.
that you could connect to,
Right.
agencies that might be able to. It's hard because a lot of the agencies that we know
Right.
are those government agencies that
Right.
are just going to get us in that
Right.
rigmarole that
Right.
we're trying to avoid.
Yeah.
You know, and I don't know if you agree with this, but I don't feel like in the moment when those officers were there, I needed anything. Like
Okay.
we were fortunate, like it was divine intervention that the officers that came to our house had training like you, who
Yeah.
have a heart for
Yeah.
this community and these
Yeah.
situations. It could have been a very different experience if
Yeah.
we didn't have that type of officer.
Yes.
So I think what I would ask of any law enforcement people listening is
Yeah.
that there would be a level. I know you can't train everybody. Not everybody wants to,
Right.
doesn't have a passion for this situation in this field. But I think it should be like standard. What do I know about law enforcement, right? But it should be standard that you know, there's a level of compassion and training and understanding, and somehow it's just the way you're talked to. Like those
Right.
officers really,
How
I
you're
think,
treated,
diffused things and
Yeah.
spoke
yeah.
kindly to our son and
Fair to say.
treated him like a human being and you know, not somebody in crisis,
Yeah.
and all of those
Yeah.
things. That's what we needed, not necessarily numbers, because I didn't really expect that from the officers.
Yeah.
That's
personally.
fair. That's
That makes
fair.
sense.
Yeah, our experience was not negative at all. It was the
That's
complete
fair.
opposite.
Thank
So
God. Yeah.
They handled it so well.
That's fair. So look, here's what and you bring a good point up. One of the things that I learned in my own experience, one of the things I learned in navigating some of this is that we know that not everybody wants to have or has a passion or care about a mental health thing. Well, we know in these COVID times, 2021, there's an increase in anxiety and depression. There's a need for our officers, our families, our therapists to train people to tell them, listen, this is for real. Like, you need to have a little bit more grace and compassion, but there's a little bit of wiggle room, but not too much, right? These guys can't have so much wiggle room. Us as parents and as family members can, but have some grace and teach them what it looks like, right? Some of the things that Meridian is trying to do, right? It's not a shameless plug, right? This is sort of thing, right? Trying to educate on what it looks like to be depressed and how do you intervene in that? What it looks like to be anxious and how do you, what it looks like to be high because people are self-medicating and the understanding that is, right? Virginia at this moment in 2021 has legalized marijuana and recognizing that people are really going through some things and they're trying to lower that stress and lower that. And so what does that look like? We have to do some of the educating in the conversation ongoing, right? And that's some of the takeaway. Maybe we can't be preventative in that moment of the call, but we can be preventative on these down days or these seasons so that maybe those numbers in the long haul kind of go down and the reaction is then necessary and important when it's necessary, right? So that's some of the takeaway. Fair. Kurt, for you, right, we talk about guys saying bring them to the hospital and whatever. What is it that you need to hear? What is it that, I know we talked about what you want to give them, but what are some of the things that we need to know exactly what is going on so that we can intervene effectively and intentionally? Are there any sort of one or two sort of tidbit things that your staff needs to hear or your staff needs to be able to do?
Well, you know, so it's different in behavioral health, especially. So for us, we don't have what we call a typical emergency department. So we're not drawing blood and going through medical clearance and differentiate with certainty that what we're seeing is a behavioral health issue. Sometimes there may be underlying medical issues or substance use that can look like the manifestation of really severe behavioral health issues. But maybe it's been a substance use binge, and that's a problem unto itself. And usually there is something underlying mental health associated with that. There's not anything in particular that we need to hear or not hear. It's just what we are fully dependent upon, especially if it's a community member that we're not familiar with from any type of prior interaction, is we're really having to base a recommendation upon the information that's being provided to us at that time. And so the better that we can triangulate information, especially if it's a first encounter with someone who walks into our lobby, for example, you know, if there is a friend or family member or loved one, and in many cases, you know, these are individuals that are out on their own and don't have the resources that they need, including the social supports, and sometimes they do. But what we have, I could just speak for our facility and I think many facilities, acute facilities like ours, a pretty comprehensive assessment with some evidence-based tools to determine kind of level of safety recommendation, level of care determination. So if someone walks into our lobby, for example, they're going to fill out some paperwork and then one of our clinicians will come out and speak with them, and we'll go through the same intentional, standardized kind of holistic assessment to determine if someone, you know, what level of care that they need. But again, what we're relying on is the information that's being provided to us in terms of content, but also we're paying attention to the nonverbals, so the mental status components as well. You know, some things are not spoken but seen as well, and then we'll make a recommendation based upon that. And I hope that's helpful, you know, to some folks. So
It is.
that's the process, the beginning process, at least for us. And I know with the community services boards, it's a pretty similar type of assessment and process. And we're thinking about, you know, okay, what's the least restrictive, but also going to be the most helpful based upon this information that we're receiving, this assessment. And so sometimes it may be a police officer that's with the individual who's asking for help, or maybe not sure if they want to get help, but at least willing to come talk to somebody. Sometimes it might be family bringing somebody in. Sometimes a person may just come in on their own, but they may be really reluctant to share really the reality of how severe that problem is for them, because, you know, they're afraid of what might happen, or am I going to get quote unquote locked up, or to be judged in some way because of this, and how might this impact my future? So there's all sorts of considerations. For someone coming in, I can just the fear. I've seen it so many times as a clinician on the front line too. It's, you know, it's got to be such a frightening experience. And so, but that's kind of the first step, and that's the initial process for us.
Fair. Great point. Listen, here's the things that I kind of tease out of this for as a clinician, as a person, right, as an individual who's worked on all these levels with you guys. Some of the things that are consistent that we need to know, right? And you can say, listen, I'm not a doctor, right? I don't even play one on television, right? So the vitals, right? So he's breathing real fast, right? And so here's the power of the phone that we got. And I don't care if you're an Apple dude or a Mac dude or or a Samsung person or not, make some notes. Right. And so we know that we can videotape. We know that we can take notes, and the vitals, the basic vitals that you may need, that your first responders may need, that you guys can kind of take note of, Kurt, that your crew may see. Right. So his breathing has been real heavy. Right. Even if it's not in the medical terms, or right, they keep pacing, or they keep talking real fast or real slow, or they're slow to respond, or they keep falling asleep, or they haven't slept in this. Get the basics. Right. In the therapy field, we talk about Maslow's hierarchy, right? And these are the basics: food, clothing, shelter. In the medical field, we're talking about vitals, and we're talking about the pressure of speech, or the pace, or they haven't done this. This is what would be helpful to you. We may not know as parents, but you can make note of these things. You can watch these things and say, yo, this might be important, or they keep saying this. Because true, it's going to be real hard to hit the consistency in the communication, because there's so many barriers that we face, from legalities, HIPAA, and everything else. But these are the things that we see in all fronts. We need to know that they're combative. We need to know that they haven't slept in 7 days. We need to know that they take this medication. These are things to take note. Take notes. And I tell my clients this, we tell our clients this at our practice: keep notes. Start keeping notes. Tell me how long this has been going on. Tell me what you've been seeing, right? If this is all of a sudden, like he left the house to go to 7-Eleven for a Slurpee, and he came back crazy and tried to burn the house down, I need to know that, right? Or I need to know that he's been trying to burn the house down for 3 weeks. That's fair. Now we know what we're dealing with. And so you need to kind of take note as parents, as family members, as law enforcement, because this is what we want to hear, just the facts, man, like Dragnet sort of thing. And even from a provider sort of side of things, these are the basics. Now let me stand back and let me take it from here and let me do what I do. Is that fair to say for all of us? Because that's a big takeaway, right? The other part of this is this, and I want you to speak on this, Kirk, because I know this is huge for you, but I also want it to be from a law enforcement, from a family member side of things, is sort of the legislation and the things that are coming down. We know that money's a barrier. I'm not going to go down the rabbit hole of money. God knows we will just start fighting in here. But we know that there's legislation and there's things in place. We know that there's things that are working or not. We know that we want this to be a platform where we can share some of the things that are happening now in real time, from what you know, Kurt, but also from the advocacy side of you guys of legislation. This is what we'd love to see. This is what we know is happening on our end, sort of thing. And so again, from the different fronts, Kurt, give me first what you know in a brief sort of way, because I want to open this up for question and answer. What do you know that's actively happening? What do you know that you want to see? And what do you know that you want to see as parents? So Kurt, what do you got?
Yeah, so on the legislative side, I want to encourage folks to visit the Department of Behavioral Health and Developmental Services website. So there are a lot of major initiatives that are underway and are being funded as recently as a special session this past August in the legislature. I think there was over $400 million allocated for, and that sounds like a lot of money. Quite frankly, you know, it's going to take more, and I think there will be more over time. So for example, with the officer, and I apologize if I'm mispronouncing it, is Hoxter, is that correct?
Correct.
Yes. So for example, what's called a Marcus alert, and that's an officer, I don't know to the extent that this has been integrated or is coming on board, but it's going to be coming on board across the Commonwealth, where there are peers embedded sometimes when there's a call identified to 911 or to a warm line, what's called a warm line, a crisis receiving or crisis call center. And that will include someone who is ideally, you know, either a mental health provider with some level of expertise and or a peer, meaning someone who's been through the process before that can respond and help, you know, the situation in a favorable way. So Marcus Alert is one initiative. The STEP VA kind of lays out comprehensively what the state's, the Commonwealth's plan and approach is over the next 5 years, I believe. And it's a comprehensive plan. So for example, it includes a centralized call center, so that there's kind of a uniformed access point for individuals that have questions, and then can be triaged over the phone, and then crisis receiving centers in each community specifically for, they're, I guess, maybe what you might call the equivalent of like an emergency department, but for behavioral health services. And then what are called crisis stabilization, 23-hour types of observation programs, things that are meant to be even in more urgent situations, lend themselves to maybe less confusing, more streamlined, easier to understand, cross systems interventions. And so again, the Department of Developmental Behavioral Health Services, DBHDS, was just on a call earlier with the commissioner and many of their stakeholders, and they were talking about kind of the walkout. They're again facing incredible workforce challenges, and that's been really the most frustrating part for all of us. We, you know, as providers, we see this immense need, and there's not the workforce there to meet the need at this point in time. But again, Solo, back to your point, you know, resourcing, incentivizing individuals to come into this workforce, into this space, it's such important work. And, you know, you want to attract people that are wanting to come into it for the right reasons, but it still needs to be resourced like other domains of healthcare, traditionally behavioral health. It's not been resourced in an equitable way compared to, you know, other types of healthcare. It's been kind of siloed away for too long, and it's coming out of the shadows. It's coming into public awareness now, and now you know, the next steps are resource and implementation. And to the point of Jennifer, your point earlier about the collaboration across not only providers but across the public and private sector. You know, that there's a lot of opportunity for that to be enhanced. So, but again, you know, the Department of Behavioral Health Developmental Services, if you log onto their website, it'll kind of lay out what the state is kind of planning and what is behind that, and what kind of data, and they're looking at other states and what's worked well in other regions and states. And, you know, there's no one size fits all answer. But at the end of the day, underneath it all, it does have to be resourced in order to be implemented. And you have to have the competent staff and providers on hand to be able to provide care. And I'll just speak frankly to the situation right now as we speak, and the officer can attest to this, has probably been involved in this. At any given time, you can go to an emergency departments here in Hampton Roads or throughout the Commonwealth, I suspect probably throughout the nation, And there are many individuals who are waiting for extremely long periods of time, both voluntary and involuntary, to access emergency care because the resources are, and workforce resources and other resources are so scarce. So I encourage all of you, anyone who's listening and is concerned about this, what we're really trying to do is just make the legislature aware of the reality of this issue. And if you can reach out to your local legislators and say, here's my experience, here are my concerns, the more this becomes real for the people that, you know, have the decision to make, are in a position to make decisions that can provide those resources, you know, that in and of itself, I think, is a great place to start and keep on it. You know, keep on it. That's what we've been doing, and you know, we're determined to keep doing that until we have a better system of care. And they're really, and I want to underscore that, you know, there's I'm not trying to place blame. There's no you know, I don't know, folks that are out there that are trying to be obstructionists in this way. That it's just a matter of understanding, coming up with cohesive and comprehensive solutions, and resourcing those solutions, implementing them, resourcing it, and I think there are better days ahead. I want people to walk away with also with a sense of hope that there are better days ahead. Unfortunately, it's a crisis that illuminates the severity of what has become, but it also provides the opportunity for these things to happen. And they are, you know, taking this very seriously, trying to be very thoughtful about this, and all of us are as providers. And so, you know, for anyone that might have any more questions in that regard, I'd be glad to speak to the best I can later as this come up.
Kurt, thank you. That's exactly it. So I think that that's the fact that we're able to have the conversation, the fact that we're able to use the resources and things we have, right? So from social media to the mediums that we have, right? To video, to record this, to send this out, to share this, to phone a friend and all that sort of thing, to advocate. The fact that you're able to give a resource, and I appreciate that. I really appreciate that, Kurt, to say, go to the website, see what legislation is coming down the pipe, but then keep the conversation going, right? And that was the other part that I take away from that, Kurt, is this: if the communication is not consistent, we will keep it consistent. Let's not be quiet. I'm not going to be quiet. I'm not a quiet guy. I don't get laryngitis often. Sorry, guys, but I'll keep talking. And so keep my situation current, and I will have the conversation with anybody I can. My wife yells at me all the time because I'll do this at Home Depot and we will talk. She's like, why do you have to talk about recovery at Home Depot? We're just trying to buy flowers. I'm like, yeah, but their family members using heroin and they need to know where to go. And so I'm going to wear a big shirt to say, ask me about heroin, right? Like, we're going to do this. Like, we're going to ask me about mental illness. We're going to keep the conversation going. And so if there's a breakdown, we're going to keep it going. For you, real quick, from a law enforcement perspective, what do you want to see, or what do you know that's happening from, you know, Marcus Alert was huge, and that's huge to know. What else in terms of legislation or things that are happening or things you want to see? Because we're going to forward this to people.
I mean, I'd like to see more involvement, either from, I mean, sort of like what he's describing with this Marcus thing. Yeah. I wasn't even aware of this, but wow. I mean, that's pretty awesome.
Yeah. And that's, I learned about it yesterday. I felt almost naive. I was like, man, I'm ignorant to not know this. So we've got to promote this. And I talked to a sergeant yesterday, and I told him, look, your advertisement and marketing sucks then, because we don't know about this. Yeah. So yeah, that's fair.
I mean, that's a big thing, is just getting the knowledge out there.
Yeah.
Law enforcement just doesn't know. I think we don't have the experience. We're trained in law enforcement, and so we need that maybe a third party, or maybe something that can come alongside or be more involved.
Okay, so this is not a marketing ploy, kind of, right? If I am here at Meridian and I say, yo, I'm going to come to see Officer Hoxter and I'm going to tell you what programs we got going on because you need to know. Is that fair to say? Yeah, it's kind of marketing. Yeah, it's my practice. But yeah, it's also, you need to know what's out there, right? So be intentional about the marketing.
Yeah.
Because in the private sector, at least, we got to tell you what's available. So you can go to the door and say, hey, Zabel, right, this is what's going on. This is what I know. You may want to try this. I know you don't want a number, Mom, but I'm going to give it to Dad, right? But I know that I heard this because this guy came by, right? That's fair. I mean, but that's fair because it's a normal conversation. And so maybe the intentionality of even the marketing, right? Is that fair to say?
Yeah.
Okay, fair. Okay. What do you want to see? What do you guys want to see? And or what do you know of, or what would you love to see happen even from a policy and procedure or legislative side, or even from our service provider side or provision side, or even law enforcement? What would you guys want to see?
You said keep it real, right?
Please keep it real. You better keep it real. I don't care how sideways it goes. That's what we're here
From a
for.
legislative standpoint, and this is probably a hot button topic, but I would like to see our legislation spend less time advocating and promoting substances that perpetuate mental illness and focusing on putting that type of those resources and those promotions on, like what Kurt said, finding resources to help people, not keep them trapped in those situations or bring out those situations. So as a parent, like you can't tell, I mean, that's just like, it angers me and it really, and I think that needs to be heard. I'm not pretending to be a doctor or understand all of the science behind the what for's, but I just, I don't understand why that's being allowed. And then I really was excited to hear Kurt say what he said about, resources to get training. I mean, being in the situation has really given me a heart and a passion, and it's kind of piqued my but and then I'm sitting here going, how am I going to, going back to school? And I think there's other people out there that if given that opportunity might, be able to help bridge that gap. So I think
well said. And I think that's very honest. I don't think that you're causing trouble at all. I think it's fair. Listen, you're a real citizen of the community. You have people in the political positions for a reason. We vote. We have November's coming up, and we know this. We know that we call shots. This is a democratic society. All of that, right? This is what I want to see, and I'm not going to be ashamed to say that. And I think that you said that appropriately enough. That you weren't picking shots at people. I think it's fair to say, listen, guys, we need this part. I appreciate what you're doing here. Yes, it's important, but I need this, and that's okay. I think that's okay. Yeah. What else, Dad?
Well, everyone's brought up, I think, great points, and what Kurt has shared, I think, it's exciting to know that there's some things coming along. Obviously, we have a better job to do with communication because there's some things that are in place that even as an officer, he's unaware of. Right. So those things, once created, I know Kurt has spoke to this. We need to resource and implement, and make sure everyone understands what is available, and then just personally, keeping that conversation going, as you mentioned.
Absolutely. So here's what I'm going to say, guys, because we've got about 17 minutes left. So everybody who's online, we're going to open up for questions in a second here. I promise. It'll either type them in or unmute yourself and pop in. Here's what I'm going to say as you guys are figuring out what you want to ask, and I don't know what's going to come, but we'll see. Here's one thing that I know, right? I know that we do this as a practice. I do this as a clinician. You guys know this just by being able to know we've known each other now for an hour and a half. If you don't have the voice, connect with somebody who does, right? And so don't be ashamed. You know that you're in a position of need, and you have a family member that's in need. So I'm going to keep talking, and I'm going to keep chirping the squeaky wheel sort of thing till I get the help that I need. You guys were fortunate enough to be able to find law enforcement, to find a clinician that does that. You also now know Kurt. Right? I won't give you his personal number. No, I'm not going to give you his address, but we know that we can connect to somebody, right? And that's the point, Kurt, right? Like, that you're a real person. So keep talking and talk it up the ladder. When I got frustrated at 2 a.m, and I never send an email, Lord knows, anybody who knows me knows I'm not administrative in any way, shape, or form. Like, for me, I could write an English sentence, but I ain't going to put a whole bunch of them together. So I must have been heated. And I emailed to the council, and one got back to me. And so send the messages. Keep chirping, send the messages to your city council, to your advocates, to your therapists, to the practice. If you do like therapists or therapy centers near me, right, and you reach out to one of them, I'm going to keep talking because I know somebody's got to hear this voice, and I'm not going to stop talking because this is that important. So reach out. Sometimes we assume as a community that somebody else is going to, or that my voice doesn't matter. And this conversation here has shown you that we're willing to just be real people, to have a real conversation. These guys were asking me, is there a dress code? I was like, listen, it's Thursday night. I'm wearing my hat and I'm bad and I haven't shaved, and that's okay because this is just a real thing. I'm gonna keep talking to real people and we will reach out and we will respond. But we can't assume that somebody else is doing the work. I'm not gonna assume that. Please don't make that mistake. Reach out, ask the question, talk about it at 7-Eleven and at over here, right, at Meridian or wherever you are, and have the conversation. Send the email, send a question to somebody, say, hey, you know somebody that knows somebody that knows somebody. Let's do something with it. Is that fair to say? For all of us, all of us. So what are the questions you guys may have? We want to field this for you guys. I've got a few that are coming in now, so I'm going to ask these as you guys get ready. We got one that said, love the idea of the t-shirt campaign, asking about recovery, mental health, wellness, etc. Let's all do that. So I guess we're all wearing shirts that say, I love schizophrenia, and I'm not ashamed to say I'm in recovery. I think that we need to say that. I think that sometimes what happens, and we didn't get the chance tonight to say, there's a lot of stigmatization that comes with substance use and mental illness. I'm not ashamed to say that I'm a therapist that struggles with depression. I'm not ashamed to say that. I'm not ashamed to say that I've tried medications and I need to do that. We have to be able to kind of take the stigma away from some of that. So that's real. Do you guys agree?
Absolutely.
All right, let's do it. Also need to address the tech addiction with our young people and their use of phones during live feeds like this. Sorry, y'all, I had to. Anxiety and depression are on the rise with screen time and with kind of being locked and trapped in. This is a real thing. When you go out to get your mail, talk to the neighbor and say, yo, it's good to see you. You haven't shaved in 17 months, right? Like, I ain't seen you, right? So that's fair. Are there other questions? Anybody got a question that you want to ask in real time?
Cello, it's Mike Bowen.
What's up, Mike?
Yeah, this is a great discussion. Two things I picked up on that really appreciated. That is what Kurt was talking about, legislation to work towards developing. That is a community-based psychiatric / substance abuse ERs. That would be great, and especially if they had some beds available too. Right. One thing I thought about you, but I missed the opportunity on this, is put in the telephone books years ago. We had telephone books and had numbers for fire and number for police. I thought we also needed to have the community service board numbers in there for each community, but we don't have that now, and I don't know how to get that information to people. Then the other thing is that lady just said, and I probably don't know your name, but that is about less time for psychiatrists and mental health professionals and regular doctors, less time perpetuating mental health. And for me, I'm very interested in benzodiazepine dependency, and I'm networking now with the Benzodiazepine Information Coalition. So working on trying to spread the word to doctors and maybe to everyone, I guess, about the dangers of benzos. Right. And that's all I have to say.
Very fair. No, thank you for that, Mike. That's very true. Here's what we know, right? From a generational gap, an age gap, even a socioeconomic gap, is that back in the day, and there is actually still a phone book that gets thrown in your driveway. It's gotten a lot smaller. It's gotten kind of weird, but everything is now on Google or electronic. And so maybe some of us who are not as tech savvy, but how do we communicate when we may be afraid of the technology or whatever? I'll tell you this. And so this is where we've got to take sort of the gap and bridge it. Some of our older generation of stuff to say, hey, you young kids, I know you're on that social stuff, put this out there, right? And so I'm willing to connect with some of my young kids. I'm willing to say that, can we get on the social media platform? Can you do the whole hashtagging thing or whatever? You may not like it, you may not know it, but that's what's happening. And so we've got to get the numbers, like Mike said, for community services, for the acute care facilities like Kurt has, for your officers and that sort of thing, to say, look, guys, I came aware of this. If you are aware of Marcus Alert tonight, somebody better put this out there somewhere and say, yo, did you know about Marcus Alert? You need to know about this. Give me more. Let's talk about this. Put that on your Facebook feed. Put that somewhere and let's see what happens. Because that is how it happens, Mike. That's a great point in terms of communication. Communication has changed now. It's really changed now. So I would love to sit down and talk and be able to do this, but not too many people doing that anymore. Great point. Thank you, Mike. Somebody else, any questions? While people are thinking, one of the things that we know is that there is a backlog in beds, backlog in resources, in crisis help when we need it. As you're coming available to resources, let's say here, let's say, you got connected to me. It's not to tell people that I'm going to see their kids or whatever, but hey, I found this, find something like this there and communicate and say, these people are available to take help now, or they're right from not just community service, but also in the private sector, in the private community. Maybe we need to talk about where we found the best help. I'm going to tell you from a substance abuse side of things, because I work with addicts. Addicts talk. They'll tell you which doctors are going to be quick to give you these pills. They'll tell you which program is going to be quick to give you this help. Why can't we do it on a proactive sort of side of things too, and communicate where we found good help, not just badmouth the bad help, but where we found good help. So make sure we talk about that. Anybody else questions or thoughts? Or if you guys got one, because this is an open dialogue. Do you think people are going to use this? Will this actually work? I have some of these crazy ideas in the middle of the night, and we have these conversations. You guys are willing to entertain me. Is this going to go anywhere, do you think? Are you hopeful, or you think this is going to be like?
Yeah, if I can speak for myself,
Please.
I was very hopeful in the conversation because I think the world is starting to recognize that there's a great need here, and we have a long way to go in being able to communicate and take care of that need. But to keep the conversation going, or to create it, and to help people understand that, if you're struggling with mental illness, it's okay and you don't need to be ashamed. And to get rid of that stigma, I was joking with, Adam earlier, that, as a guy, we're taught, if you talk to a therapist, you're weak, you can't cry because you're a man. Those things are just, facades that don't lead to real help.
Right.
But we have to be willing to be honest with ourselves and seek the help and create this conversation and make it to be normal.
Yeah.
And in addition to being, a parent, I also pastor a local church. And for me, it's important for even our congregation,
Right.
I've told,
Even in
that
the faith
I
community.
see a therapist.
Yeah.
And if you need to see a therapist, that's okay. To me, it's a point of strength to be able to have that conversation. And whether it's a moment of crisis or, to me, the benefit is begin to see someone before you get there.
Right.
Start the
Be
conversation
preventative,
to kind of get the help you need, because it's okay.
Yeah.
It's necessary. And I still see a therapist today, and I have no shame in that. And I would encourage anyone else who struggles to do the same.
Great point, Alex. Look, the stigma exists not just because of one reason, because it could be the cultural stigma, it could be the faith-based stigma, it could be the gender stigma sort of thing that exists of me not being able to make this a normal conversation for many of us for many reasons, right? I'll tell you, in the communities of color, it's not very strong when a Black man can tell you, yo, I cry a little bit and I see a therapist. What do you mean there's strength there? Or to say in faith communities, how come God can't help you with this? Or in the law enforcement community that says you're weak because you got to suck that up and keep it moving. We know there's stigmas that exist for many reasons. Are we willing to, now I'm going to get a little feisty, do we have the balls to do that and cross that line and say, we're going to keep knocking down these sort of stigmas that exist within the communities that we are in, and we will not stop until that barrier breaks? Maybe that's how we normalize some of the conversations. Maybe as those conversations are more normal on the ground level, they reach the political sort of level. Fair?
So I just want to dovetail on that, and come back to your original question. What does this do, right? We know what we do know is if we do nothing and we say nothing, nothing's going to happen.
Great point.
So yes, this does make a difference, and I will say this as well. In my experience, which has been pretty novel before this year, and interfacing with our legislature, both locally at the city council, our local delegates and senators, all the way up through, the state, and even a little bit beyond that, is they do listen, but they're sometimes they're just getting information or different bits of information, but they've been very receptive to to hearing and to wanting to understand. So yes, things like this do make a difference. And then taking that next step beyond after this conversation, okay, well, you know, what can I do? You mentioned, you know, the social media platforms, you know, yes, there is definitely, you know, there's an up and down side to all of this, right? It can cause some compulsive things, and we know that what does our dopamine receptors, and Dr. Bowen can, you know, probably speak towards that better than anyone on the panel here, but that, you know, that it also kind of gives you a voice, you know, and where that before that wasn't, that type of opportunity wasn't possible before we had those venues. So however you can, you know, speak out about it and speak towards your experience, and that is authentic, it's credible, it's real, and you know, just keep taking action, keep speaking out, and that's really the only way things are going to be acted upon. And so, and I see that happening, and I see that there are results coming out of that, and there are a lot of people in positions, you know, that can have a bigger influence, or you know, it starts here with these types of discussions to roll uphill. And so I applaud, you know, you all for sharing, being vulnerable, and sharing your stories, and being real, because that is exactly what is needed.
Look, Kurt, here's the truth, right? So people, me and Adam were trying to connect last night to talk about this. I think that was just last night, right? As I connected with each one of you guys panelist wise, and recognizing the chaos and craziness that is just day-to-day life. Some of us think that we're too busy, or we've got too much, or we've disconnected from the ground level of things that are happening, right? And even in my conversation, while Adam's trying to reach to me, and I'm trying to get in touch with Kurt, you know, and I know Kurt's got a ton of stuff going on, but we think almost, well, you're too busy for. But it takes some of us that are so busy to stop and really have a conversation. It takes some of us who may not be as busy or think we're not as busy, because each one of us have our own responsibilities, our own right, from the stay-at-home parent to those of us who are running companies, to say we need to have this conversation and stop and take a moment to talk, to listen. Like you said, Jennifer, that was probably the most effective thing, right? Listen, stop and listen to me for a minute, and have the real conversation, and connect with some of the people who have some power. If you don't think you got power, you know somebody who does, and connect with them. And you've got your own power within your own community, on the front lines, to even some of the legislative stuff. Fair?
Yeah.
But we've got to be able to stop long enough to have these conversations ongoing. Why do I talk at Home Depot? Because I'm gonna have the conversation. Yeah.
Can I just?
Please.
Yeah, you know,
And with that, Jennifer, I want you to say, because we're wrapping up, I want to respect the time. Tell me what the takeaway is as you go with this, and what each one of you guys' takeaway is. So please.
Yeah, so I just want to say thank you for having this. I think, you know, to your point, I think you almost keep being brave and keeping the conversation going, because, you know, it's a movement, right? It's an opportunity for there to be positive change. So thank you for doing that. I'm excited, Kurt, to see the CEO of BB Psych on a call, because I believe in leadership is from the top down. And so that encourages me from a community standpoint as a parent. And so that makes me want to stay, you know, if in any way that I can, to stay involved, because there can really be some positive change when you have someone like you running something like this, and a CEO of a psych center feeling this is important enough to be here. So thank you for that. Thank you to our law enforcement. That's, you know, you're representing those who really do have a passion and care about the community and mental health as it relates to law enforcement. So I think for me, the takeaway is encouragement. I think there's a lot of people out there that really do care. And to your point earlier, we do get wrapped up in our negative experiences. But I think if we collaborate and we come together and we each bring what we have to the table, we can initiate some really good change.
And that's what I saw when I envisioned it a few weeks ago. It was, okay, let me take somebody from this walk. I don't know what we have to put to the table, but when we are able to do that in a collective space here, holy cow. And that's just a few stories here. Imagine, right? And so allow yourself to dream and be able to do that on a bigger scale and keep it going. That's a huge takeaway. So thank you. You're right. What do you think, Alex?
Well, first of all, I want to thank you as well, not just for creating the conversation, but the difference that you're making just in our family. And I know countless others that you work with. You're making a difference. Kurt, I can hear, in addition to, running a facility and as busy you are, what I hear is your heart for people who are struggling, who are hurting, and your desire to help, create and implement something that will make true change. So I thank you for everything you're doing. And, Adam, in law enforcement, you're here because your heart is for people who struggle in this area. And, and I'm so thankful. So, just real quick, there may be some who listen to this now or even later that hear the need, because, even if we implement some things, there's still a need for the workforce. And that's one of the biggest, missing pieces here is people to fill in the gaps that can really help touch the lives of people who are struggling. I just hope that maybe this will inspire some to either begin a career in mental health counseling or switch careers, as as some are doing, because you're really making an enormous difference, changing lives. So thank you very much.
That means a lot. Thank you. Because it's funny, we often hear in our field, especially when it comes to addiction, what is your success rate? Or even when it comes to like number one, we never track that. Number two, we never hear those, right? And we know this in the medical community as well. When you're well, you just keep going, right? It's like when you taught your kid how to ride a bike and they finally got it, you were like, hey, look back so that I can take a picture or say thank you. Like, no, they were gone. And we never saw them again. And so it means a lot to hear it, because so many times, and I'll tell you even personally, like, man, this is discouraging. It's exhausting. So it's really, while we may not even say thank you in the moment, it's appreciative to hear that, because, man, sometimes we don't feel like we did enough. And so thank you. Thank you. Thank you guys for having the balls to sit here and do that. Thank you. What's the takeaway, Adam? And what's the, or the final thoughts or whatever sort of thing?
I mean, this is an awesome venture. This is about collaboration. It's about communication. I'm on board. I want to see it happen. I want to be a part of it.
Yeah.
I feel like it's a huge thing. I feel like it can't go anywhere but up. It's awesome to see this family here. Parents who love their child, child who loves his parents. Parents are both involved with their child. It's just a wonderful thing. And honestly, that is the saving grace for everything your child's going through.
Good point.
It's an awesome thing. And I'm so excited to be a part of it in any facet I can. I'm just happy to be here.
No doubt. I really appreciate your time, man. Thank you. That means a lot. Listen, again, when I keep using that word, my mom's gonna yell at me, right? Because it takes balls, right? Even as an active member of the community of law enforcement, when you know that there's protocol and this and that, but you're like, listen, this is worth the risk. Some of the work that we do, some of the conversations we're having tonight are risky, right? It was risky, right? When you say that you're a pastor and you got a church and they're like, yo, but I just saw you do this. Yep. When you say that you're a man that owns a business and does, I saw you do that. When you say you're law enforcement, right? It's risky and you're willing to. So I appreciate that. It does not go unnoticed. So thank you. Kurt, what are your thoughts or your takeaways?
I think that you, Salo, and the rest of our panelists wrapped everything up beautifully. And I just want to add that, you're the ones that inspire us, and you live this, every day in a very intimate way and in a very impactful way. And we, as a system of care of providers, owe it to you to do better, and for the officers as well, for all the stakeholders. And so these conversations, they plant seeds, and then there's actions. So I just want to encourage everyone again, to number one, hope is so important. So retain that hope, and then take action. Even if it's something small, reach out to someone, and someone that maybe you have a voice and the next person has a voice, and keep after it. Because it's going to take that level of collective commitment and action to really impact change, and not only impact change, but in a sustainable way. So just thank you for sharing your journeys with all of us. And if, after this, and Saul can help you, get in touch with me and my team or whoever it might be. If there's anything we can help, assist with resources or otherwise, happy to do that. So just humbled and appreciative to be a part of this. So thank you.
Yeah. You said it right. Like you guys said it. I'm empowered, because I get a little feisty sometimes and I get a little antsy. But then I'm also encouraged when people come on board and say, yes, because you were feisty and antsy and wouldn't shut up, it gave me the opportunity to. And so that we see that it takes each one to reach one, right? Sort of thing. Don't shut up. Don't stop the conversation. Ask the questions. There's so many more resources. There's so many more layers to this. I've seen the questions coming in, and I want them to keep coming from knowing that we need help with our teens, knowing that we can't help if we don't know what the need is, and knowing that these conversations need to continue. This is just one. So please encourage those around you to do it. Please know that we are only able to provide the service because you are willing to seek the help and ask for help and do that. We're one practice here, right? We have Meridian Psychotherapy Services at Gmail, right? Email us, find us in your Google sort of thing. Find Kurt at VB Psych, right? Find officers and friends and communities and pastors, right? But look and continue to ask the questions and tell us what you need. We didn't intend for Real People, Real Talk to happen more than once. And so now we've got two, maybe we've got more conversations. Me and Kurt had come up with one and we know that there's more. So let's keep it going.
And just one thing,
Yeah.
just one other person I wanted to thank, because we wouldn't be on the panel if our son wasn't,
Amen.
hadn't given us the permission to have this conversation.
Amen.
We had asked him, and this is a passion of his to help other people and get rid of the stigma. So I want our son to know how much we love and appreciate him, because his willingness to be vulnerable is helping other people.
No doubt. Very, very true. That's why we do it. So I really appreciate everybody's time. I really appreciate you guys, your energy and your passion. Keep up the good work. For those of you who are online or doing this work, Kurt, I can't thank you enough, brother. I guess you did earn this gift card. So I'm gonna bring that to you, all right? And so thank you guys too. I really appreciate you guys. Keep the questions coming. Keep the conversation going. This is Real People, Real Talk at Meridian Psychotherapy Services. Out. Appreciate y'all.
Bye, everybody.